Hello, everyone, and welcome back to another episode of Manifesting Health. We're so excited to have with us today Dr. Daniel Smith. He's an assistant professor in the PhD in nursing program at the University of Buffalo School of Nursing and an adult health nurse practitioner providing primary care in the homeless at Buffalo City Mission. Uh, Dr. Smith is the director and principal investigator of the ROPEH Lab, which stands for Research for Occupational, Public, and Environmental Health. Welcome.
No, thank you for having me.
We're so excited to have you join us. We're thrilled about having this conversation about environmental health and how environmental factors play into some of our decision making and policies and so forth. But before we get started, I want to spend a little time letting you talk about yourself and how, your journey in this space and how you ended up where you are today.
Yeah, so my journey starts on a dairy farm in North Carolina back in 1995 when I was born, right? And I really started seeing the impact that the environment or humans were having on the environment, right? Was really kind of seeing, I remember this concept of eutrophication coming to play. So before I became a nurse, I have a degree in biology, and eutrophication is whenever agricultural runoff causes small ponds, lakes to fill in from the fertilizers, literally that we're putting on our fields being washed down with rainwater, and they fill in kind of the lake from the bottom up by killing all the organic materials in there.
Wow.
Right. So as I was going through my biology degree at UNC Charlotte, I came across a nursing professor who did public health nursing.
Hmm.
And I always knew that I wanted to do something in the medical field. I really wasn't sure, right? Was it med school, PA school, nursing school? Had all the options open. And Dr. Maren Kaufman, she and I started talking about my interest, and it was really her who introduced me to this idea of the nurse clinician scientist, right? That you can be a clinician and also do science because I knew that I liked working with people from volunteering and my work as a medical interpreter. So I also am bilingual in Spanish. That'll come out in a little bit, but really the combination of everything. And so it was from her that I decided to apply to Emory University's what was at the time called the AMSN program, Accelerated Masters of Science in Nursing. Took us non-nurses, made us nurses in 15 months, then threw us into an NP program, right? So hell on earth, basically, but it was all good. And then while I was at Emory during my BSN program, portion of the program, I realized that I wanted to do research. I missed it. I missed being in, so I was in a wet lab in undergrad. And at Emory, you can do your PhD and your NP at the same time. So I thought kind of naively as a 22, 23-year-old, I was like, let's do it, right? And applied, got in, and it was really in my nursing training and then further on in my PhD that I started to see that reverse corollary being true of not only do humans impact the environment, but the environment impacts our health and impacts humans, right? And I consider myself, I got very lucky, found a mentor who was doing work with outdoor farm workers, needed a Spanish speaking nurse, and I spoke Spanish. And so I was able to join her team that was studying the impacts of occupational heat exposure on kidneys in farm workers. And that's what really, I mean, has led to my program of scholarship continuing, my clinical interests. I mean, I'm working with the homeless now, but I still go down to South Georgia for 2 weeks every summer, and we do pop-up clinics for the farm workers down there. And really just trying to, my main goal as a nurse scientist, and even as a nurse practitioner, but more so as a nurse scientist, is to keep people safe from the heat.
Thank you so much for telling your story and your background. It's great to see that passion within the environmental factor and how that plays into so much. And you've talked about a little bit with this about how important environment is into health outcomes across populations, not just our migrant population, but our populations from all over the world for that matter. Tell us a little bit more about some of those main characteristics and main factors that play into such as water supply safety and, pesticide. I mean, there's so many different things, not just the heat in, as what you're saying, but can you tell us a little bit about where we are in knowing how influential it is for environmental factors playing to our health?
Yeah, I like to say that environmental factors are the number one determinant of health, right? Because whenever we say environment, I think a lot of people they think about outdoors, right? But your environment can even be indoors in your house, having housing, right? And I think it's really that connection of seeing the environment for more than just the outdoor world as really what is driving how everything we touch, from our water to the air we breathe to the temperatures that we're existing in. Kind of funny that we're talking about heat as one right now whenever the feels like temperature is negative 17 outside.
The major
Uh,
cold fronts coming through. That's right. That's right. That's right.
right. But like I can guarantee you that I will have patients that will lose limbs and toes and fingers from the frostbite from this cold
Mm,
front, right?
right. Right.
So I like to think that the environment is the number one kind of determinant of health. I know, like people like to use sociopolitical, right? But like all of that really determines our environment, and the environment is anything and everything around us as humans.
I'm glad you mentioned when you're talking about some of these environmental influences and impacts and factors, because it's a difficult time right now trying to figure out where the support's going to lie for whether it be additional research, policy, and so forth. What are some of the challenges that you're seeing in our current climate when it comes to maintaining the importance of environmental factors playing into our health as a planet, as a country, as a region?
I think of, and it's hard to not get political with this one, so I apologize, but just the threats of research funding, right? For me as a researcher, I'm still fairly new within my career, right? 5 years post PhD, and when the current grant that I have right now that looks to understand how community heat signatures influence kidney health outcomes, whenever that ends, I'm not sure where the money is going to come from to continue the work, right? I think that's one of the ways in which we as nurses as a whole, being the most trusted profession, we have to use our advocacy voices to really ensure that the research and science, no matter if it's environmental health or research and science broader, right, that is being funded is as robust as possible. I really see the threats to research funding as being the main driver to understanding, continuing to understand, right, that the have how the environment is impacting health, because I think we all get it at a baseline level, but there are a lot of questions out there that we still don't really have answers to other than, well, we can kind of conceptualize that that might work, right? But we don't really know because the studies were just getting off the ground whenever they were all paused.
One of the other movements that we're seeing quite a bit on, I'd love to hear your take on this, is, as we continue to move forward with innovation and as we continue to move forward with new concepts for this or that, and AI now in the space that it is, there's so much attention now brought to a lot of these in order for this to be the next big innovative leap for us is the data centers, of course. And it's not just about data centers, it's the entire infrastructure that's around this next big leap in technology. What do you think is, I mean, we hear things, whether it be a news feed or a news story and different documentaries and so forth. What do you think is, we know that it's a challenge, we get it, we
Yep.
understand what it takes to do that. Where do you think us becoming more in a collaborative space to understand to get here, this takes this is another benefit. How do you think we can get to a point of understanding how we can live together with this?
Yeah, I think it takes conversations, right? And really not seeing things as black and white, because I think we want to, from an environmental health standpoint, right? Like I would obviously say data centers are bad. We don't want them, like we
Right,
don't
right.
need them,
Yeah.
right? But then as someone who also does a part of my research is big data, like I need that in order to analyze the data, to have the insights that I can potentially get from my 100,000 patient records that I have for
Right,
my
right,
grant, right?
right.
I think it requires innovative thinking.
Mm.
And one thing that I saw, and I don't know if it's true or not, but someone was saying that in some of the Nordic countries, there are thoughts about putting the data centers underground and capturing the heat to heat homes, right? So I think whether it's happening or not, it's a really interesting idea of, well, why are we thinking that they have to go above ground? And obviously, there's still going to be pollution no matter if they're above or below ground, but we should apply this harm reduction theory, if you will, of they're going to happen anyway. So, how can we keep people as safe as possible? And I think that's a really interesting kind of intersection between my clinical practice and my research
Mhm.
is before I was in Buffalo, I was a harm reduction nurse practitioner. And so, really thinking about how do we keep people safe while they are using whatever substance of choice, right? So, treating Hep C, using PrEP, all of the above, right? Safer injection needles, anything that's involved with it. And I think that can be applied easily to environmental health of it's not this black or white pull of data centers are bad, so we shouldn't do them, but we should think about how can we implement them in a way where there's still some benefit while also recognizing there is harms and we should be whoever the engineers that are designing these
Right.
data centers, right, should be doing this innovation that we all think about in nursing of how
Yeah.
can we keep designing data centers to be
Yeah.
cleaner and better for our health.
And we're going to continue to use them 10, 15, 20 times a day we're doing our daily work or helping us in our
Yep.
function as well. So it'll be there. So thank you for bringing that up. I would like to take a little shift and talk a little bit about specific barriers when it comes to environmental health considerations for men. So for the male patient population, what do you see some of the biggest challenges are in incorporating the environmental health piece, the occupational environmental health with the male patient who already has disparities in their outcomes?
Yeah, so I'll really take this one from a very occupational lens. At least in the work that I do, right? Like the majority of participants in my studies and even the clinics that we run in South Georgia are male migrants, right? And we deal a lot with you're at increased exposure risk because you're inherently doing this job due to sociocultural norms that are kind of forcing you into agricultural work, outdoor like construction workers, all of the things, right? And men are stubborn. And I hate to say that, but
Yes, we can be.
we are very stubborn. And so, one of the biggest challenges that I see in kind of my clinical practice with the farm workers specifically, like trying to get people to use like simple PPE to protect
Mm,
themselves from pesticides, which is it's a double-edged sword, right? Because you want people to use PPE for the pesticide exposure, but then the PPE is hot, so they're not wearing it because they're hot, and you're putting them at increased risk for heat-related illness. But we see it all the time, right? Like we want these men to use personal protective equipment, and for whatever reason, they're not. I think it's also we have a very strong culture. I mean, even here in Buffalo, with my homeless clients that I work with, there that stubbornness can come through because the practice that I'm at is within a men's homeless shelter.
mm,
And that stubbornness can come through of just simply like accepting help, right? To get housing and get off of the street because there's this we can pick ourselves up by our bootstraps kind of thing
mm.
that's been ingrained in I think Americans, right, for many years, but particularly male Americans of you can't rely on anyone to help you, so you got to do it yourself.
Right,
And
right.
with
And
environmental
the stereotype that if you do ask for help, you're weak. So it's
Yeah, exactly. Exactly. Like trying to get some of my clients to start on SSRIs, right, for their anxiety, their PTSD. Like it is just this catch 22 of these men, they come to me clinically and they're like, we know that this is bad for us for whatever reason, right? Living on the street, working in the heat, but we have no other options. So
right.
what do we do to again reduce harm as much as possible?
Thank you again. Daniel, this has been a great conversation to put us really to make sure we're thinking about the environmental factors when it comes to seeing our patients or considering male care and so forth. So thank you so much. In our last couple seconds we have together, what are some takeaways that you would like to have for our listeners?
Yeah, I think number one, if you're working outside, use your PPE, as annoying as it might be, right? Keep it on to prevent your falls. But also for those of us that are going to be working in this space, just have an open ear, listen to what your patients, all patients, right, but particularly your male patients are saying, meeting them where they're at. And remember that environmental health is something that, whether you think you do it or not as a nurse, is something that you are going to do on a daily basis.
Right. Exactly. Well, thank you again for your time. I really appreciate your expertise and your thought in this topic area. So thank you for joining us.
No, thank you for having me.
Excellent. Thank you all for listening again on this episode of Manifesting Health, and we look forward to seeing you next time.